AI training has a data problem. Companies need billions of examples to train models, but real world data is expensive to collect, slow to label, and often illegal to share. In this video, I'll show you how synthetic data is changing that. We'll cover what synthetic data is, why major companies like Waymo are using it to train autonomous vehicles, and how healthcare organizations are bypassing GDPR restrictions with it, and the actual cost numbers that explain why 60% of AI training data is now synthetic. If you're building AI products or making decisions about AI infrastructure, this shift affects your timeline, budget, and competitive position. Synthetic data is artificially generated information that mimics the statistical properties of real data without containing any actual real-world information. A synthetic patient record looks like a real medical history, demographics, diagnosis codes, treatment timelines, lab results. But it doesn't describe a person who exists. A synthetic financial transaction has realistic amounts, timing patterns, and merchant categories, but it never happened. The market numbers show how fast adoption is growing. Gartner reports that over 60% of data used for AI applications in 2024 was synthetically generated. They predict this will reach 75% by 2026. The synthetic data market itself is projected to grow from $510 million in 2025 to $2.67 billion by 2030. Let me walk through 3 real implementations that show why this is happening. Waymo has driven over 25 million autonomous miles on public roads, but they have simulated billions of miles using synthetic data. Their simulation city platform creates entirely synthetic driving scenarios. Engineers input parameters like spring showers in Detroit at sunset, and the system generates corresponding camera and lidar sensor data. The synthetic data includes raindrops on sensors, solar glare, reflections, and weather conditions. They can generate a complete 8-hour synthetic drive from Tucson to Austin. The autonomous driving system experiences scenarios that would take years to encounter in real-world driving. And here is why this matters. Rare events like a pedestrian suddenly appearing from behind a parked truck in heavy rain are critical for safety. But they are rare in real data collection. You cannot train a system to handle edge cases by waiting for them to happen naturally and hoping your vehicle is there to record it. Waymo's technical approach uses their foundation model to generate realistic sensor data. They take real-world lidar and camera feeds, reconstruct 3D scenarios, and render those scenes from different angles, lighting conditions, and weather. Their Surf Eigen system converts these reconstructions into realistic camera images. A 2020 research paper from Waymo showed they trained models on 798 sequences of real data, then generated thousands of synthetic variation. The system produces camera images realistic enough that human reviewers have difficulty distinguishing them from real footage. In December 2024, the EU launched Cynthia, a €22.4 million research project running through 2029. The project addressed a specific problem. European researchers need to share patient data across countries to study diseases, but GDPR makes this legally complex and slow. Cynthia generates synthetic patient datasets across 6 diseases: lung cancer, breast cancer, multiple myeloma, diffuse large B-cell lymphoma, Alzheimer's disease, and type 2 diabetes. The synthetic data includes lab results, clinical notes, imaging data, genomics, and mobile health data. A pharmaceutical company analyzing cancer treatments across multiple EU countries would normally face months of legal agreements, compliance reviews, and data protection assessments before accessing patient data. With synthetic datasets, researchers get statistically valid data without triggering GDPR's cross-border transfer requirements. The UK's Information Commission officer published guidance in 2023 acknowledging that properly generated synthetic data can be used for research and AI training without the same legal constraints as real patient data. Singapore's Personal Data Protection Commission issued the similar guidance in 2024. A 2024 study published in NPJ Digital Medicine demonstrated synthetic health data maintaining clinical utility while protecting privacy. Researchers generated synthetic patient records using different privacy techniques and then trained predictive models. The models achieved comparable accuracy to those trained on real data, but the synthetic training data carried no re-identification risk. A 2024 research paper published on Arxiv demonstrated something that challenges conventional thinking about data quality. Researchers trained computer vision models on ImageNets using purely synthetic data. The models achieved 70.9% accuracy. When they scaled up the synthetic data volume, accuracy reached 76%. For comparison, training on real ImageNet data typically produces 75 to 80% accuracy depending on model architecture. The synthetic trained models were competitive. Another study showed that models trained on 95% synthetic data plus 5% real data matched the performance of models trained entirely on real data. The synthetic portion provided volume and edge case coverages. The small real portion prevented distribution drift. So here is what this means economically. Collecting and labeling a large-scale image dataset costs hundreds of thousands of dollars and takes months. Teams need to source images, remove copyrighted content, hire annotators, manage quality control, and handle legal compliance. Generating equivalent synthetic data costs orders of magnitude less. Industry reports indicate 70 to 90% cost reduction when switching from manual data labeling to synthetic generation. Synthesis AI, a synthetic data company, grew 410.6% in 2024. DataGen raised $72 million, the largest funding round in a synthetic data space. The market is validating this approach with real capital. The successful implementations follow a hybrid approach. Pure synthetic data carries risk. A 2024 paper in Scientific Reports showed that models trained exclusively on synthetic data can experience performance degradation on real-world tasks. The solution combines synthetic and real data. Most practitioners use 70% synthetic, 30% real. The synthetic data provides volume and rare case coverage. The real data grounds the model in actual pattern. A practical implementation starts with use case identification. Where is real data scarce, expensive, or legally restricted? Healthcare patient records, financial transaction data, autonomous vehicle edge cases, security threat scenarios. Then calculate current cost. What are you spending on data collection, cleaning, labeling, and compliance? One financial services company documented $2.3 million annually on data labeling for fraud detection models. After switching to synthetic data for training with real data for validation, cost drops to $300,000. The technical implementation requires validation frameworks. Generate a small synthetic dataset first, 1,000 to 10,000 examples. Validate against the held out real data. Check for distribution drift. Iterate on generation parameters. Only then scale to millions of examples. The constraint in AI development shifted from compute to data. Cloud providers solved compute scaling, but data collection, especially compliant, high-quality, edge case-rich data, remains a bottleneck. Organizations integrating synthetic data into their infrastructure gain 3 advantages. Number 1, speed. Iterate without waiting months for data collection. Second, privacy. Train on sensitive domains without exposing personal information. And third, generate training data for new markets without establishing local collection operations. Companies treating synthetic data as a workaround rather than core infrastructure will face competitors who built it into their training pipelines from the start. Thank you so much for watching this video. Please subscribe for practical frameworks on AI implementation you can use in your organization. See you in the next one.